Dr. Thomas Matras, both from the Veterans Administration. Jennifer is a licensed clinical social worker and executive director for Veterans Patient Experience, when she oversees implementation of transformational initiatives and consultation services for enterprise-wide improvement of the veteran patient experience. And Dr. Matras, after 15 years as a frontline primary care provider and a board-certified internist, is now in the Office of Primary Care as Director of Primary Care Operations, bringing that experience from the field back into improving the experience of veterans. Thank you both for joining us today.
All right, can you hear me?
Yes.
You've got me. Okay, well, great. Well, thank you very much. We are thrilled to be able to speak to you from the Department of Veteran Affairs. We're taking a unique approach here. I'm going to tell you a little bit about the listening and the learning that we have gained and garnered from our primary care patients. And then Dr. Matras is going to talk to you from the the provider perspective in primary care. So I am attempting to move this next slide over here, and let's just see if it works. It does. So just to start out, the Department of Veteran Affairs, Secretary Wilkie's #1 priority is to improve the customer experience for all that experience, care, and services with the department. The Veterans Administration set up an office uniquely oriented to understand the veteran experience from the veteran, but also from the family, their caregiver, and their survivor's perspective. And this Veterans Experience Office has been working really to improve the ease, the efficiencies and effectiveness of care with the emotional resonance of receiving the care by engaged employees, and then ultimately to improve trust. And I was just thrilled to hear Gwen talk about the need for trust from both sides, from the employee as well as from the patient and their caregiver. So at the Veterans Experience Office, in order to be able to look at how to impact the trust, we start with the patient. And what you see here on the slide is a study that we did. We looked at patients from across the country, from all different backgrounds, who receive primary care at the VA, and we asked them, what matters to you? What are the moments that matter most in receiving care with the VA? And what we learned, and this is a journey map which uses a human-centered design approach to understand these moments that matter, is we really focused on what it was like before the visit. What did patients feel like they needed to have to be prepared for that visit? We also listened to what it was like arriving at a facility or at a clinic to receive care, or even turning on the telehealth button to open up an appointment. We learned about what it was like to have care in the exam itself with the clinician, what it was like once the care was done and as they were departing the facility, and those immediate next steps, which could be going to the pharmacy or going to the laboratory or imaging. And then ultimately what it was like when they got back home after the visit, and how fast they received test results. Did they know what mattered or what their role was in receiving their next parts of care? So what you see at the bottom of this journey map are the 5 moments that mattered most to our patients once we synthesized this. And this was about 100 patients that we asked these questions to. So you can see from the patient's perspective, they want to get the appointment when they needed it. So that might be Saturday, or it might be my only slot I have available is Tuesday at 2 o'clock. And can you make that work so that I can get an appointment when I need it? The next thing it was making it easy to find their way to the appointment, especially places that have a large facility footprint. It's really hard to find your way around, and that raises anxiety and stress before you ever even get into that clinical encounter. And those moments really matter to the patient and their family. Once they're in the exam, they said to me, I really want to feel heard and I want to trust my provider. I don't want to explain myself over and over again. Then they said to me, tell me what's next and help me by making it easy to get prescriptions. And then finally they said, I want to understand what my role is in receiving my whole health care. So they were speaking to that continuity of care. I've talked a little bit about our goals here to make things easy, effective, and emotionally resonant. But I think what matters most from the patient's perspective was that they got the care and services that they needed, that it was easy to get the care that they needed, and they felt like a valued patient. That was what mattered most. At the department, we are also now taking this information that we know, and we are measuring against that. So what you see here, this is the data from the last 6 months of care, and you can see the huge N that we have. So scheduling an appointment, we asked 49,000 people. This is a real-time survey result. Was it easy to get your appointment? We actually asked the questions to the moments that mattered most to our patients. And you can see here almost 86% said, yeah, it was easy to get my appointment. So you can see the scores here, and what's important about this is we use this to understand how we're doing. We find areas of compliments, of concerns, and we know where to focus in as we work to make improvements across the system. And I just want to also call out the trust. So primary care, feeling like the patient trusts the care that they receive from the department. I just want to show you over this time frame how we're improving, and we are 88.4% at this very moment in just specifically primary care. And then I want to turn this over to Dr. Mattra to talk to you a little bit about primary care in general. Okay, I'm not hearing Dr. Mattra. Are you? Bob, can you give me a thumbs up or a thumbs down?
Let's see, can you hear me now?
Yes, we've got you.
Okay, I apologize. Along those lines, I want to thank Jennifer for that lead in and for the group for having us to share the VA experience. My kids do consider me a technological Neanderthal, so I'm going to ask someone else to advance the slides for me, please. But this slide is just to give everyone an idea of the scope of what we do with primary care at the VA. This is a macro level task to provide primary care to over 5.5 million veterans enrolled in our system. And so we do have a very large foundation for some of the experience that we're going to share with you today. Next slide. In terms of what does primary care mean? Well, we've recently started working on our primary care directive through the VA, and the Office of Primary Care has put together this at the moment as our definition, and I don't even think this does it complete justice, but there's many catch comments here in terms of what we expect out of care and veterans themselves. Jennifer touched on access to care, ease of use, understanding where they fit within their care. And in our opinion, in order to accomplish that, our patient-aligned care team, or our PAC model, which is based on this patient-centered medical home, is absolutely critical to delivering what the veterans want and what we as an institution want to deliver for primary care. If you focus solely on patient experience or staff experience or satisfaction scores, you don't want to miss the fact that you have to be providing evidence-based care with good outcomes, that you have to have access, that your workload has to be appropriate. It's critically important that whatever you adopt, it can touch on all of those things. That's when you know you have the right mix and you can deliver on what you want. Trying to rob Peter to pay Paul to focus on any individual one of those metrics ultimately leads to failure. Next slide, please. So this is our model, and a few things I want to point out. It's a little bit of a busy slide, but really everything starts with the patient. This is critical. We're talking about people's lives here, and as we've heard from many of the speakers already, everyone has a slightly different definition of what's important to them. It's critically important to understand that and to work with the patients towards their best ends. This gives them the motivation to stay engaged with their healthcare and to work with the teams and to receive comprehensive primary care. Obviously, the model is critical, and so that's why it's on this slide. And although I'm not going to go through it point by point, when we talk about comprehensive primary care, we're talking about prevention. We're talking about integrated mental health care. We're talking about care coordination, case management, social work, all of those elements that are critical in addition to just determining what the correct medication or what the correct therapy might be. Next slide. So here's some data that I'll share with you. When we look at our high-functioning PAC teamlets compared to our PAC teamlets that aren't as high-functioning, we see significant statistical differences. I'll let your eyes take you where you will on this slide. We have many examples of it, but again, the key is you have to build the bandwidth, you have to build the expertise, you have to build the ability to share workload in order to, on a daily basis, not only meet what's coming at you, but take care of it in a responsible way. Next slide. So the key is you have to develop the entire picture, and this is what I would heavily advocate for. In the definition of high quality primary care, what I would advocate for is removing the term clinicians and replacing that with the term comprehensive care team. So I'll read it from the beginning. Primary care is the provision of integrated, accessible healthcare services by a comprehensive care team who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. If you look at this picture, what makes it beautiful is everything. If you subtract out the mountains, if you subtract out the rock formations or the trees or the river or the waterfalls or the sky or the clouds, it's substantially diminished. The key to primary care, in our opinion, is that you have to have that comprehensive model that brings all these elements together. That's when you can create something that's incredibly functional and beautiful and meets the needs of our veterans. By the way, this is Glacier Point in Yosemite. If you've never been there, it's worth the trip. It's absolutely gorgeous. Thank you. I'm happy and looking forward to fielding questions a little bit later.